Okie dokie. Chapter 1. Phlebotomy, past, present, and the healthcare setting. Okay, this one's pretty simple. We're just going to talk about phlebotomy as it came about, okay, and what it means to us now. So, the practice of phlebotomy has been around for ages. It started in Egypt in 1400 BC. Tomb paintings show leeches being applied to patients for bloodletting. Okay, so we would use leeches to take blood out of patients because we thought that something was wrong, right? 460 to 377 BC, health depended on balance of 4 humors inside the body: blood, phlegm, black bile, and yellow bile. Bloodletting was often used to remove excess humors. Doctors thought that if there was an imbalance of these 4 things, or of one of these 4 things, that we would be sick. Okay, that's what caused illness. That's what caused disease. So they would bloodlet to try and balance everything back out. Does that make sense? We know today that that isn't the case, okay, and that was all just something that they made up, and that it didn't actually work. 17th and 18th centuries, phlebotomy became a major therapy. Lancets and fleams were used to cut veins and arteries. Cupping and leeching were starting to be practiced. So these are what lancets used to look like, okay? They were just really sharp pieces of metal or steel that they would cut into veins with. Barber surgeons would perform bloodletting and leeching. Barbers were the surgeons at that time, right? So if you see the red and white barber poles, those are related to medical or healthcare because barbers at that time were surgeons as well. Bleeding bowls were used to collect blood from patients. This is what a bleeding bowl looks like. There's an indent because they would slice a wrist and then just place the hand or the wrist through that hole and then just let it set there and bleed out, okay? We still practice some methods today. Cupping or dry cupping penetrates deep into tissues, mobilizing blood flow and causing the tissues to release harmful toxins that can then be removed from the body. We see this a lot in sports, okay? Athletes will go for cupping therapy. It just helps release blood and release toxins from the muscles, pull blood to the surface of the skin, and get rid of all those toxins after a huge exercise or something like that, okay? Leeching is also used, but it's a lot less common. It's used as an aid in microsurgery procedures such as skin grafts and reattachment of severed limbs and digits. Leech saliva contains a local vasodilator, anesthetic, and an anticoagulant. So it is helpful in the use of these procedures, but again, it's pretty rare, not used all the time. The goals of phlebotomy today are a little bit different than they used to be. Today, we want to provide excellent patient care to everyone that we encounter while obtaining blood specimens for diagnostic purposes and monitoring treatments. We remove blood for transfusions at donor centers and remove blood for therapeutic purposes, okay? And an example of this would be taking someone's blood and then sending it away to be turned into eye drops for them, okay? The methods we use to collect blood are venipuncture, which is blood collection via a needle inserted into a vein, capillary puncture, blood collection via a lancet puncture of the skin, and arterial punctures, blood collection via a needle inserted into an artery, which we don't do anymore usually, okay? Depending on where we work. Venipuncture is going to be the one that we're going to be practicing the most. Capillary puncture we'll be using mostly on kiddos, okay? Unless you work in like a plasma center or something moving forward. We do a lot of capillary punctures at plasma centers as well, but when you're in hospitals or clinics, it's mostly kiddos you do capillary puncture on. To become a phlebotomist, you need a certificate, which is a document granted by an agency or school that requires 1, a completion of academic as well as hands-on training requirements, 2, the attainment of satisfactory score on a comprehensive examination, and 3, voluntary or may be required by a facility or employer, okay? If you want to get a job as a phlebotomist anywhere in Idaho, you have to have a certificate. It is required. However, you don't have to test nationally in Idaho, okay? or get a license.
Can you take this certificate, though, and test nationally if you were to move out of state?
Absolutely. Yep, and I have the resources for that. So if you guys want to test nationally after this course, I will give you all the resources to do so. Resources to do so, okay? A license, or what you'll get if you test nationally, is an official document or permit granted by a state agency that is recognized by law, requires specific education, experience, and passing an exam. Continuing education is designed to update the knowledge and skills for specific groups of healthcare professionals. Participating in continuing education can help prevent costly errors and reduce the risk of lawsuits. As policies and procedures change, we need to make sure that we are staying up to date on that, as it is with any job, just because we want to make sure that our quality of healthcare stays the same, okay? And we are consistent. Questions so far? This is just kind of the beginning.
I do have a question.
Yeah.
If you get licensed, are you licensed in every state then with that other license, or do you have to?
It depends on the state's requirements. All the states are different for healthcare and EMS requirements, so it just depends. It could very well be so, but it might have an employer who says, well, you need this and this and this, okay? Whereas if you have an employer here, you just need a certificate. Okay. We're going to talk a little bit about professionalism in healthcare. Professionalism in healthcare is the same as professionalism in any job, okay, or in any aspect of life, I guess you could say. We want to make sure that we're paying attention to professional appearance, self-confidence, integrity, compassion, self-motivation, dependability, and our own ethical behavior. Okay, these are all important things that keep us professional throughout our daily lives. Self-confidence is huge. This is probably the hugest one for me, or the biggest one for me. It's my favorite. It's what I'm gonna be kind of like beating like a dead horse and grinning into you guys, okay? So a phlebotomist who displays self-confidence is able to trust his or her own judgment. This is huge. It's important. If you walk into a room and you say, hi, my name is Sam, I'm here to take a blood draw, and someone says, how long have you been doing this? Or do you think you can get it? And you are down on yourself and you say, I'm pretty new, I don't know if I can do it, but we're gonna see, okay? Immediately they're gonna be like, well, they're not gonna get it.
Find someone new, please.
Yep. And some people will say, get me someone who knows what they're doing, okay? Which beats down on you even more. So be confident, okay? Perception is reality. The patient is gonna perceive whatever you bring to them, okay? Whatever attitude you are holding, they're gonna see it and they're gonna see right through it. The more self-confident, the more professional he or she appears. If you act like you know what you're doing, even if you don't, if you act like you know what you're talking about, give a little conviction, okay, they're gonna be like, oh yeah, no problem, here you go, okay? So we wanna work on that, and we're gonna work on that throughout the next 5 weeks. Integrity, a personal feeling of wholeness derived from honesty and consistency of character that can be seen in a person's actions, values, and beliefs. Do what is right regardless of the circumstances, okay? If there is something that is happening that you know is wrong, or if someone asks you to do something that you know is wrong, you can say no, okay? Protect yourself, protect your own job, have integrity, and do the right thing no matter what the circumstances or the outcome are, okay? An example of this from my experience would be when I was at Luke's, I had a kiddo that came in that was very, very sick, okay? They didn't know what was wrong with this kiddo, but she was tiny, little tiny. We have daily maximums and minimums that we can, daily maximums that we can take, okay, from patients, depending on their age and weight. Daily, weekly, and monthly maxes. Well, this kiddo came in and they wanted every test imaginable, okay? So we took the minimum amount for each of the tests that they asked us to. And the first time we went in, we took like 15 tests. And we took all the minimums, but we had reached our max draw for the day based on her weight. All of those results came back, and the doctor wasn't pleased with them, and it didn't tell them anything, so they wanted more. They said, okay, we want to do this panel now, this whole thing of tests. So I went and I looked at all the minimums, and I added everything up, and it added up to our max for that day, our daily limit of blood we could take. So I said, nope, I will not be drawing blood from this kiddo today, okay, anymore. We are gonna come back tomorrow, okay, and then we can start drawing blood. And he was very mad. And he wrote me up and was super irritated that I wouldn't do it, and that I basically told him, if you want blood from this kiddo, you can draw it yourself because I'm not jeopardizing my position, my job, okay? So make sure that you are just paying attention to the little things, okay? Because if you take too much from somebody, especially when they're little tiny, it could be very, very bad, okay? Compassion. Being sensitive to a person's needs and willing to offer reassurance in a caring and humane way. This one is going to be huge in hospital, okay? If you're working at Luke's or Al's or whatever, even clinics, people are coming in, okay? They're having surgery, or they've had a stroke or a heart attack, or they are, you know, something's really wrong. They're very sick. Maybe they have cancer, okay? Compassion goes a long way. People are going to talk to you about it, okay, because they're in the hospital all by themselves. Who else are they going to talk to? And you're a healthcare professional that they trust when you come into their room, okay, for the most part. Some people aren't very trustworthy, but most people are. They're going to want to tell you about themselves. They're going to want to tell you about their lives. They're going to want to tell you that they want to die. They're going to want to tell you all sorts of different things. You need to be able to handle these situations and be compassionate of them. Can I grab you anything? What can I do for you? Do you need anything from me, okay? Stuff like that. Questions about this? Self-motivation, taking initiative to follow through on tasks. Blah, blah, blah. Consistently striving to improve correct behavior and taking advantage of every opportunity, okay? I want to see self-motivation in this class. If we have, for example, when we start venipuncture, if we're having some difficulty or stuff like that, I'm going to work through with you, okay? I'm not like, well, you suck. You know what I mean? I'm going to work through things with you. I'm going to make sure that we're building confidence, building trust in each other, and working on self-motivation. I want you to be motivated to do the work, okay? To push yourselves and to not be afraid when we're starting to poke, okay? Take initiative to do things, and not in class, but when you are at work, take initiative to do things. If there's a draw that pops up and no one's really jumping on it, be like, okay, I'll go do it, okay? If there's things that need to be stocked, if there's things that need to be done, take initiative to do them. Okay, make your life easier. Be dependable. Someone who works hard and shows constant, reliable effort and perseverance. People who are dependable are a valuable asset to a healthcare organization. They're a valuable asset to an employer in general. Okay, I don't have to tell you this. You guys are adults. You know what it means to be dependable. You know how important it is. Okay. Have ethical behavior. Ethics is defined as a system of moral principles and standards that govern conduct and the distinction between right and wrong. There are policies in place. There's a code of ethics for each place. Okay, each employer has a code of ethics, but there's just a general code of ethics, okay, for life that you should follow. Policies lead to uniformity and define expectations, okay? Every place is going to have expectations that they want you to follow, how they want you to act. Patient rights. We're kind of getting into the realm of patient rights now. Confidentiality. All patient information is completely private and confidential. You're going to be dealing with patients on a daily basis. You're going to be asking them their personal information, okay? You need to keep this to yourself. HIPAA, or the Health Insurance Portability and Accountability Act, was established in 1996. This protects patient information. If you work, for example, for a company like St. Luke's and you violate HIPAA, you will be fired. Okay, it's very important that we keep confidential information confidential. Private information private, okay? On page 9, there's a little snippet about protected health information, if you guys want to read about that. But it's very important that we're keeping everything that we need to keep private, okay? Do not give out information about your patients. 2 documents have been published to strengthen consumer confidence, and this is strictly patient confidence in the healthcare system, okay? Because sometimes people are a little wary about the healthcare system, okay, and what the goals are. So the Patient Bill of Rights in Medicare and Medicaid and American Hospital Association's the Patient Care Partnership. It has been found that patients who are informed about their treatment and prognosis and who are considered part of the decision-making process are more satisfied with their care. This means that a patient who has been involved in the entire process from beginning to end, hey, this is what's going on. This is why we need these tests, okay? We want to take these tests because we're concerned about this. If we do this, then we can do this, then we can do this. Is that okay with you? Yes? Awesome. Or, hey, we're doing this right now. You have to be okay with it, okay? People are going to have questions. Why is this happening to me, okay? Is this going to help me? Or is it going to be detrimental to me? They want to know that. So people are more confident in their care when they're informed about things and involved in the decision-making process when it comes to whatever care is happening to them, okay? The patient care partnership, and I've put it into a pie because I think it's cute, but these are the characteristics of the patient care partnership. We help with billing claims. We give high quality hospital care. We have a clean and safe environment that makes patients feel more comfortable. There's involvement in their care, protection of privacy, and help when leaving the hospital. Okay, these are all important. If you go into a hospital or a room and it's dingy and dirty and you think, yuck, I don't want to receive care in here. What kind of illness am I going to just get from being in this room? Okay, we have involvement in care that lets people help decide what happens to them while they're in our care. We give high quality hospital care to the best of our ability, okay, because we want them to be comfortable and confident in what we're doing. We help with billing claims, and this isn't really our department. It'll happen at registration, billing claims will. We help them when they're leaving the hospital, make sure they have everything they need, get them a ride home, get them a cab if we need to, okay? And we protect their privacy, okay? We just make sure that we're not giving information to anyone unless they've given us consent to do so. We have different hospital facilities. Inpatient or non-ambulatory facilities are the key resource and center of the American hospital system. They offer specialized instrumentation and technology to assist in unusual or emergent diagnosis and treatment. Examples of this include acute care hospitals, nursing homes, and hospice. Outpatient or ambulatory is medical care delivered on outpatient basis. Patients requiring care after discharge from the hospital. Examples are freestanding medical care settings, hospital-owned clinics, outpatient departments, or urgent care facilities. And then we have homebound services, which are patient homes and or long-term care facilities. Okay, something more of a living facility where healthcare providers come or where there's a constant healthcare provider staff. The characteristics of a hospital are permanent inpatient beds, 24-hour staffing services, therapeutic and diagnostic services, and organized medical staff in tiers. Okay, so you have physicians, you have physician assistants, nurses, so on and so forth. A little bit of everything in a pot, okay? This is going to be your St. Luke's, your St. Al's. Healthcare financing, also something that we're not really gonna be dealing with that much. We have a couple of different methods of payment. Direct payment, the patient pays the provider outright. Okay, this is for people who don't have insurance. They're going to be paying the provider for the care that they receive. Indirect payment or third-party payment is an insurance company, federal government, managed care program, or self-insured company pays the provider. Okay, third-party payments are when you bill your insurance, okay, or the hospital bills your insurance for the care you receive. Diagnosis and billing codes are current procedural terminology codes in Table 1-5. We will not be going over diagnosis and billing codes just because we don't need them. We don't need them for what we are doing. Sometimes you might see diagnosis codes. The only time this is going to happen is if you're reading like a diagnosis code sheet sent over to processing from a doctor to put orders in for a patient for a blood draw. I've done this maybe just a handful of times, okay? Usually they have someone that they've employed sitting at the desk that gets all of these codes, and they're the one who processes and puts in the orders for the blood draw, okay? As phlebotomists, that's not your job. If it is your job at some point, that's great. You'll learn all the diagnosis codes particular to that position. Does that make sense? Everything, it's different. Some diagnosis codes are the same, but it's different depending on where you go. And then we deal with also reimbursement through Medicare and Medicaid. But that's also not something that you'll be doing unless you get a job at a desk, okay? But as phlebotomists, if you are pursuing a phlebotomy job with your credential, you'll be going somewhere like a plasma center. You'll be doing a phlebotomy as like a certified lab assistant, okay, in a lab. You won't be sitting at a desk processing codes, okay, or billing. Communication is going to be huge, okay, when we are dealing with patients. The components of communication are verbal, through the spoken word, active listening, taking steps to ensure the listener is interpreting what the speaker is saying exactly as the speaker has intended, and non-verbally, which is body language, okay? This can include facial expressions, gestures, and eye contact, and then we want to make sure that we are aware of personal space, our own personal space and patient's personal space. Make yourself known, make your presence known, state your intentions, and establish a rapport. It looks like this. Knock, knock, knock. Good morning. My name is Samantha. I'm here from the lab. I need to take a blood sample from you. Is that okay? Yes? Okay, great. I'm just going to get my supplies ready. How's your day going? How did you sleep? Okay, can I grab anything for you? Okay, stuff like that. Establish a rapport. Talk to them. See if they need anything from you. Let them know what you're doing. I'm just going to get my supplies ready, and then I'm going to come over to the patient. I'm going to say, okay, I'm going to tie a tourniquet on you real tight, okay? Let them know step by step what you're doing. All right, this is going to be a little cold. I'm rubbing alcohol on. All right, take a big deep breath. 1, 2, 3. We're in there. We got it, okay? We've got blood. Give me 30 seconds and I'll be done, okay? Let them know what's happening. Establish rapport. Be nice. Be funny if you want to. People like that, especially when they're in some place as dreary as St. Luke's. Okay. We have a communication loop, and it is the same for all communication, whether we're communicating with patients, whether they're communicating with someone we know and love, someone we just met, okay? There is a sender. They have an encoded message that they want to relay to a person, so they use all of these demographics to create a message, okay? Culture, gender, emotions, language, physical, does that say issues? Physical issues, age, okay? All of these play into the way that we communicate with someone. We're not going to communicate the same with someone we just met as we are with our best friend, okay? We're not going to communicate the same with our grandma as we are with our boyfriend, okay? It's different. Then the receiver decodes that message, okay, and relays a message back. This is our closed communication loop that is constant. Questions about that or anything else we've gone over? Okay. Telephone etiquette is something that you should know already. We all have our telephone voice. Okay, it's much nicer than our actual voice. But proper telephone etiquette and protocol is very important in the lab. The reason why is because people are going to be calling saying, ooh, I have a blood draw, and people are nervous, okay? They're going to be calling with questions. They're going to be calling with comments and concerns, okay? Sometimes anger, too. A lot of the calls that I got when I was at Luke's were, how do I get to where you are? Where are you guys located? How do I get there, okay? Or I need this information sent to this place, or I need help setting up an appointment, or whatever, okay? Proper telephone etiquette impacts quality of patient care and is vital to efficient and effective services, especially in the patient's eyes, okay? We want to make sure that we answer the phone promptly. Don't let it ring for too long. People get irritated when they're waiting, okay? State your name and your department. Hi, St. Luke's Lab, this is Samantha. How can I help you, okay? Be helpful to the best of your ability. Don't strain or kill yourselves trying to get information that you don't know, okay? If you don't know, say, I'm not sure about that. Let me transfer you to somebody who knows, okay? Don't be afraid to do that. Prioritize calls, transfer and put on hold properly. Make sure that you're letting patients know, hey, I've got to put you on hold really quick. And then prioritize them. Make sure you're not just leaving them for 5 minutes, because that creates an issue on its own. Record important information. Who is this? Okay, why are you calling? What's your name? Date of birth? Okay, who's your doctor? Record all this information so that you have it when you're giving it off to whoever's next. Know your laboratory policies. Each laboratory has their own policies. Make sure you know what they are regarding this kind of thing. Diffuse and de-escalate hostile situations. Now, this is pretty rare in a job like this. We don't really have a lot of like super pissed off people, but it's not impossible, okay? Someone might be very frustrated about something that has nothing to do with you, but just de-escalate. Say, oh, I'm really sorry that that happened. Let me do my best to help you out, okay? And then assist everyone and find the right answer for them, okay? Do your best. You're only human, okay? And just remember that there are other people who can handle things as well. If you need to transfer it off, do that, okay? Clinical laboratories generally have two major areas, a clinical analysis area and an anatomical and surgical pathology area. All laboratory testing is associated with these two areas. Similar tasks are grouped into departments. The goal is to perform each task accurately, efficiently, and cost-effectively. Now, when I'm talking about two areas in the lab, I'm talking specifically about a place where tissues and actual physical samples go, and then where all of our clinical analysis happens. And so this is going to be things like blood samples, okay, urine, stuff like that. Stat labs are established in some tertiary care facilities, typically located in or connected to emergency rooms, and they're for procedures and tests that need to happen immediately, okay? At St. Luke's, it's set up so that the lab is right next to the emergency department, because whenever someone comes into the emergency room, I shouldn't say whenever, but most of the time when someone comes into the emergency room, we are taking blood from them and it needs to be tested quickly, especially if it's heart attack or stroke, okay? That blood gets taken directly to the lab. There's a stat sticker on it, and we say, test this now. We need the results as soon as possible, okay? We have reference labs, which are not on location. So if we needed to send something to a reference lab from St. Luke's, we would have a courier come pick it up and take it there. It's off-site. It's a larger independent lab, receives specimens from many facilities in city, state, or region, provide routine and specialized analysis of blood, tissue, and urine, and offer fast turnaround times and reduce costs due to high volume, which means all the hospitals and clinics send their blood to the reference lab. Okay, there's only one. They send it all there. Then the lab takes each sample and they say, okay, this is a CMP, this is a CBC, this is a whatever, whatever, whatever. They group all the tests that are the same into one place and test them all at once. Okay, it reduces the cost. Every time they run a machine, it costs money. Okay, so they run everything at once so they can get a lot of results at once and run the machine one time. Save money. Okay. The laboratory departments are something that we're going to talk about when we start talking about where each test goes, okay? But for now, we're going to talk about them. We've got hematology, which is for blood and blood-forming tissues or whole blood tests. Coagulation is a sublab of hematology, okay? So we have coagulation tests, which test the ability of blood to form and dissolve clots. Chemistry is most lab tests. Serology and immunology are serum and autoimmune reactions. Urinalysis is urine tests. Microbiology are microorganisms in body fluid and tissues. And then we have blood bank or immunohematology, which is where we do our blood typing and storing blood for blood transfusions, stuff like that. Okay? And we'll talk more about these later on. Anatomical and surgical pathology include histology, cytology, and cytogenics. Histology is a microscopic structure of tissues. Cytology is the structure of cells. And cytogenics is a chromosomal deficiency and genetic disease. If you are on page 24 with me, you'll see table 1-7. This is just a list of tests that we see pertaining to chemistry. Okay, and I promise you we'll go over this and review this 1,000 times. You'll be more comfortable with the tests that are associated with each color tube and each lab. But for now, this is just kind of a short list. But we have BMPs, CMPs, electrolyte panels, hepatic function panel, lipid panels, renal panels. Okay, so this is liver and kidney function, all of our electrolytes, okay, blood sugar, stuff like that, all in a nice little test that tests all these things. Okay, from one tube. These all go to chemistry. They're kind of our basic everyday tests that everyone has. These are hematology tests. So we have hematocrit, hemoglobin, red blood cell count, white blood cell count, platelet counts, differential white count, which is just how many types of each white blood cell you have. These are going to be things like how hydrated you are, okay? How much oxygen your blood is carrying or able to carry. Your whole blood count, whole white blood count, which can tell us about infection, stuff like that. Coagulation tests are for cardiac patients mostly, just to see how well, okay, our blood, how long it takes for our blood to coagulate. We have APTTs, or activated partial thromboplastin times, D-dimers, fibrin split products, fibrinogens, prothrombin time, international normalized ratio, PT-INR, and thrombin time. These are just the most common. That's why they're on this slide. Serology and immunology tests include ANAs, rapid plasma regens, human immunodeficiency viruses, Epstein-Barr, hepatitis B, hepatitis C, immunoglobulins, rheumatoid factors, CMVs. Okay, these are the most common for this type of test, for this lab. UA tests, okay? These are the things that are important when we're looking at UA tests. As phlebotomists, we deal with urine, okay, and poop. I'm sorry about it. Poop, urine, blood, okay? So when people come and give you a urine sample, we don't really test for this stuff, but just in case you guys are doing any sort of processing, these are the things that you should know to look for. We need to make sure the color is right, okay? If there's blood in the urine, you're gonna be able to tell. It's gonna be brown or red, okay? If that's not good, what color is urine supposed to be? Straw colored, or less than that if you're hydrated enough, okay? We wanna make sure that there's not any floaties. Is it clear, okay? And not clear like see-through clear, but yellow clear, not foggy. Is there blood in it? Okay, we can test our bilirubin, glucose, ketones, protein, and nitrites with urine. Okay, so sometimes we won't be doing blood draws, we'll be doing urine instead. Microbiology tests include blood cultures, CLO, which is breath testing, fungus cultures, gram stains, and acid-fast bacilli, which we don't do a lot of, but you'll be doing blood cultures a lot in hospitals, okay, and we'll talk about what blood cultures are here later, but blood bank and immunohematology tests include type and screen, type and cross-match, type and RH antibody screening, and compatibility testing, okay? Type and screen and type and cross-match are the two biggest ones. This is just when someone needs a blood transfusion, we're taking blood to, number one, blood type them and see what type of blood they need, okay? Then we are cross-matching their blood type to the donor sample to make sure they're compatible, okay? If we give someone the wrong blood type, it's no good. Very dangerous, okay? Getting into clinical laboratory personnel, this is just kind of the rundown of the tiers of personnel in the lab. So we have our laboratory director or pathologist who manages the lab along with the administrator. Maybe a pathologist or a clinical lab scientist. A pathologist is a physician who specializes in diagnosing disease. Then we have our lab administrator / laboratory manager. This is usually a technologist with advanced degree and experience. They oversee all operations involving physician and patient services, may supervise ancillary services, which include respiratory therapy and radiology. We move forward with our technical supervisor, who administers a lab section or subsection, reports to a lab administrator, and has additional education in one or more lab areas. Okay, so this means that they have gone through a couple of different lab areas and now they have expertise or training in each of these areas so they can move up to the next tier. We then have our medical technologist / medical laboratory scientist. Typically has a bachelor's degree plus study in a medical technologist program. Performs all levels of testing in any area of the lab and reports their results, performs quality control and evaluates new procedures, maintains their own instruments. So this person is also familiar with multiple sections of the lab, okay? They have gone to school for this specifically. There are programs where you can become a medical laboratory scientist or a medical technologist, and you learn about all the different sections of the lab. You're familiar with them, and you can move back and forth in between. You also perform quality control and maintain your own testing instruments. Okay, so all the machines in the lab, stuff like that. Then we have an MLT, or medical laboratory technician, who has typically associate's degrees, performs routine testing, operates and maintains all equipment. Okay. Then a CLA. CLA is what some hospitals will advertise a phlebotomy job as. It's the same thing. CLAs and phlebotomists are the same, except for one thing. Typically, a CLA will have phlebotomy experience. Then they will have skills in processing and some testing. Okay, that's the difference between a CLA and a phlebotomist. Typically, until you become a phlebotomist and learn how to do it well, you can't move into CLA until then, because you'll have to learn how to process some samples, how to, for example, spin down samples and move the plasma or the serum into a different tube and then send it off to the ref lab or whatever, okay? We process things sometimes, spin things down, help out the medical laboratory scientists so that they don't have to do literally everything when it comes to working with samples. And we can assist them in those areas. Whereas a phlebotomist strictly collects blood for lab tests, for diagnosis and care of patients, serves in role of lab assistant or specimen processor. Formal programs usually require high school diploma or equivalent to enroll. So phlebotomists and CLA are pretty much the same thing, minus some experience in processing specimens. That's it. Okay, and processing specimens is very easy. It's very easy to learn. Then we have other lab personnel that helps the lab run smoothly, which include computer programmers, laboratory information system managers, quality assurance managers, and point of care coordinators. Questions about this?
I have a question.
Sure.
So the testing and the processing, is that something that typically happens on the job?
It can, yeah. So it depends. In my experience at St. Luke's, I didn't really do a whole lot of processing. I was strictly doing phlebotomy and blood drawing. Sometimes I did, but it depends on your placement. So for example, I was the 4:30 a.m. to 1 shift. They have morning, afternoon, overnight. If you were overnight, you didn't have a processor, so you had to take care of that role as well, okay? But in the morning, we didn't have time to do processing, so they had other people that were there doing it. Right? So it just kind of depends on the position they have you in, okay, and where you're at. Al's, Luke's, in a clinic, in smaller clinics where they don't have as much staff or someone maybe specifically hired to process, you would be taking on that role as well. So you would have the person come in, draw their blood, and then you would process the entire thing and send it out. So we'll work on processing and stuff a little bit. We'll work on transferring samples, stuff like that. And we'll talk about processing, but if you go to Al's or Luke's, it's less likely that you'll process rather than if you work at a clinic. This is kind of just a visual of what we just went over. So we have our pathologist or our director, all of our sub labs down here, okay, with our director of anatomical and surgical pathology who manages these sections. Okay, supervisor of point of care who manages these sections, our supervisor of blood bank who manages transfusion medicine, so on and so forth. And we're down here, okay, in this tier. Questions about this? Okay. We're going to talk about the Clinical Laboratory Improvement Act, or CLIA, of '88. A federal law regulating all sites performing lab testing in the U.S. must follow the same standard regardless of their location, type, or size. This sets requirements for the laboratory director, technical consultants, supervisors, and testing personnel. This just is in place to guarantee that each lab is performing the same test the same way, okay? Consistency is what we're looking for. Consistency is key. We want to make sure that if we're sending a CMP from a Boise lab to the reference lab and a CMP from a Washington lab to a ref lab, those two are tested exactly the same and the results are exactly the same, gotten in the same way, okay? just to maintain stability and consistency in our testing processes. Does that make sense? Okay. Questions? Comments? Concerns? Okay. Chapter 1.